So let's get started. This is about the first topic, the program. It's about pediatric immunization programs. The first and one of the most important learning objectives is that you're able to outline the milestones in the history of pediatric immunization programs. It is so important that we have reached out to Stan Plotkin to give us an overview of this history. And Jürgen, what do you think could be highlights from Stan's talk?
I think it will be interesting to learn who observed the first time violation in history. Something else that is interesting is to learn what the first vaccine is that was developed in a laboratory. And another thing that comes to mind is finding out who actually found out that people can use inactivated bacteria to develop whole cell vaccines.
Okay, so a few highlights from Stan Plotkin's talk. The next learning objective is that you should be able to review the impact of pediatric immunization on the disease epidemiology. And that is just so important because here with vaccines, we're not dealing with individuals, we're dealing with populations. So as we actually treat or prevent, in this case, we have effect on populations. And we have asked Alberto Tozzi, who has worked for many years at the Italian Public Health Institute, to review this topic with us. Some highlights?
I think Alberto will tell us how we can interrupt the circulation of pathogens, and he will also tell us how we can measure the impact of immunizations.
There you go. And the third really important learning objective is that you're able to describe the basic ethical considerations of both testing as well as implementing vaccines. Again, here we're not dealing with an intervention affecting a few individuals with disease, but we're talking about an intervention really reaching out to every child possibly on this planet. This is what a lot of these programs are trying to achieve. And so we have asked Nahia Salim from Tanzania to share specifically the aspects, the ethical aspects of implementing immunization trials and programs in low and medium income countries. So from her talk, where would you take sort of the key lessons?
I think especially the ethical implications of modifying disease epidemiology and of modifying the duration of protection will be very interesting to learn from Nahia.
Okay, so we hope you enjoyed this first topic, and we will be talking to you a couple of weeks after you have probably heard this video for the first time. Thank you.